Um, there we go. So the next meeting, we're going to have a guest speaker who actually has a PhD in sociology, but has a bachelor's and a master's degree in psychology. And so he's just going to kind of come and talk about some of his experiences. And, it'd be interesting to hear, like, why did he go, what, instead of like doing social psychology, why did he go sociology instead? But he has like a master's in sports psychology. He's an expert in human sexuality and stuff. And so it's like, I was always interested, to hear what these different options are. So I just wanted to start off. No, now it's. Oh, sorry. I'm looking. I'm looking at that. This is going to distract me. Let me close this. All right. So I'm going to start off with this. I have this in my 100 class, and it's just the idea is that this was out of 1.5 million people in 2019 that had a bachelor's, that were in the workforce still and had a bachelor's degree in psychology. This was the jobs that they had. So obviously the largest area was other management and related occupations. And you can see here, it was just a limit, 1% were psychologists. So that's not to deter you guys. It's just so there's a lot of, like, if you're a psychology major, there's a lot of psychology majors, right? So it's one of the biggest majors. It's a third largest major at Orange Coast College. So obviously, a lot of people aren't going to go on to graduate school. They either, you come across different barriers, right? Whether it's family, money, time, all sorts of different things. So, I started off thinking that a psychologist means like a practicing psychologist, right? Someone who's like a clinician. So I thought that that's what I was going to do when I first started school. Really, I'm not. I've never been a clinician. And so there's different reasons. So I think not just to make you think, like, deter you and think, oh, well, I'm not going to end up in graduate school. It is important to understand that people, you have experiences that might change the route that you go, right? So for me, I took Intro to Experimental Methods at San Diego State, and I fell in love with research. So at the same time, I was also taking I was a social work minor, and so I was taking a policies class, and I can't do this. So I decided I wanted to do research. And so, but I didn't want to do the type of research I was doing at the time, which was developmental. I didn't really want to do clinical types of research. So I needed something much more objective. And so I went the research route and ended up doing a PhD in neuroscience. So I thought I was going to be a researcher at that point, and now I'm not there. Now I'm somewhere on the other side. Oh, post-secondary teachers in psychology. That's the other 1% that have their bachelor's degree in psychology. So I managed to follow the other 1%. But and then why didn't I stay in the research game? Was really it was a family thing. So I had my first daughter, where I wasn't doing psychology related research anymore. It was not family friendly. They wanted long hours. It just wasn't worth it. And it took me a long time to have my first child. So I think if I had gotten pregnant right away, I would have been a completely different mindset, completely different mother. But it took us 5 years to get pregnant with her. And so because it took that long, it was like, now I want to spend time with my kid. So that's why I ended up teaching. And I love teaching. So it really, really is a good gig for me. Then this one shows how many. So there's an estimated 205,000 individuals in 2019 that held a PhD or doctor or professional degree in psychology. So PhD or PsyD, I'm guessing. And you can see here, this is psychologists. And I think it was like 44% of the people who get the PhD in 41% are practicing psychologists. So why do they get a PhD in psychology and not practice? Again, you find other things, whether you end up doing research, or suppose you have a PhD, you end up doing research. So maybe you're somewhere in top level managers or executives or admins. And then this one was, I think it's like 11% end up teaching psychology. So, but then I don't see research on here, which probably on there someplace. There's statisticians, but just to show you that, it's not always a straight path. And then, like, I have a friend who I'll probably talk about her again in a little bit, but she's an LMFT, I think, she's a licensed marriage family therapist. And so when she got her degree, and then she had to do her hours, her licensing hours. And so it took her a while to do that. that she was working at a clinic while she was doing that. And then once she got her private practice going, she realized that how, it's a lot of work to have your own private practice. And then she had kids. And so she also, a lot of times, not all, but a lot of therapists will work evenings because that's when people aren't in work and can actually go to the therapist. So she started teaching. So she would have a couple days a week where she taught and didn't have to worry about trying to. I mean, she had a pretty good balance, but she says now she almost completely teaches. She has a very small private practice. So she didn't think she would teach, but she ended up really enjoying teaching. And so she's teaching. She teaches. She's a non-tenure track faculty at Long Beach State. So, and then I think she might have also gone that route because some schools, like if you teach, you get free tuition for your kids. So, but I don't think her kid's going to a state school. If we have time at the end, I'll show you these websites because they're actually kind of cool. Like how, like you can, or we can post the links too, because it's kind of cool how it's just the way they have all this data. So this is again 2019. I don't know why they haven't done anything new. But this is showing you psychology bachelor degrees holders in 2019. So it's 3.7 million individuals who held a bachelor's degree in psychology in 2019. Where they went, what they ended. Okay, so this actually I'm gonna go to the website for this one because it's really cool. I know lots of you have classes. So this kind of shows this is 28.9% went straight from a bachelor's degree in psychology to a PhD in psychology. So, or 13%. That's what's 28,000, sorry. So 13% went straight to no. Oh, it's 4%. No, that's not. Oh, that's the total number. This is just showing you the direct pathway. The options that you have is that you can go straight from a bachelor's degree to PhD, which sometimes students don't realize. That you don't have to do a master's in between. So it's 0.8% went directly though. This is the percentage that obtained a master's degree and then went to a PhD. So I did a master's degree in psychology after my bachelor's, mainly because I decided I didn't want to be a clinician, but I also didn't want to just be like a 6-year college student. So I got my bachelor's degree and then I got my master's. My master's was a developmental master's degree, which meant that it was really for people who didn't do so well in school and they needed to show that they could do better, that they could go higher, do a higher level degree, right, an advanced degree. And so I didn't come out of my master's degree with like any type of licensing options. It was just really developmental in nature. I did it because I was trying to figure out what I wanted to do. And then a lot of the people who did that degree too either came from other fields or like returning students too. So we had a significant number of returning students. And then there's also, of course, the percentage that so there's this percentage here that did a bachelor's degree and ended up doing a PhD in something else. Then there's people who have degrees in other things and end up doing PhDs in psychology. So just to kind of show you there's different pathways, right? It's not always a straight line. So, all right. So in terms of careers in psychology, this is kind of the categories I break it down into. There's academic settings, like where we are now, right? There's clinical settings or psychological practice, and then there's everything else. So, so in academic settings with a master's degree, you can teach at a community college. So to get hired full time, a lot of times they prefer you to have a PhD, but they will hire adjuncts. And then also sometimes, they'll hire full time someone who has a master's degree. This is more, and that's in psychology. In other disciplines, it's a little different. So you can also teach at liberal arts colleges, research institutions, and then there are a number of non-tenured lecturers at four-year universities. Like my friend who got an LMFT, she is a non-tenured lecturer at Health Long Beach. I knew somebody else who was doing it at San Diego State. So it's just, they'll hire a limited number. That just means that when you don't have tenure, you don't have a guarantee that you're going to have a job. It's kind of year to year. Sometimes they'll do 3-year contracts. I have a friend who, she actually has her PhD, but it's in I think education. And so she got a 5-year contract at Chapman, but it's like, so then at the end of 5 years, which is probably coming up pretty soon, they either extend it, look for new applicants or whatever. So the PhDs are, or PsyD, I should have included PsyD here. They're, they can teach and do, well, PhD would be the one doing the research. So teaching and doing research at a research institution. That's what most individuals with PhD in psychology are probably going to do. Some will also, if they're going to teach, if they're not going to do private practice. So, but sometimes they end up doing other things like teach at non-research institutions or become a non-tenured lecturer. So there was a faculty member here who she worked here for a long time, I don't know, 15 to 20 years. And she had a very long commute. And the lecture opportunity came up for her at UCLA. That's where she went as an undergrad, and I think or at least her PhD. And so she left us and she went up there. It's much closer to her house. So, I mean, she was coming from Culver City. So it was a long drive, yeah. So, and there's probably some other opportunities, but those are kind of the basic, straightforward ones. So what most of you probably think you want to do is be a, oh, I should also say, there are PhDs, like, so we have a guest, actually, yeah, you didn't introduce yourself, huh?
No, yeah. Hi, I'm Laura. I'm a PhD student at East Riverside, and I'm doing an internship program where I come here and watch Dr. Ferguson teach and learn about what it's like at the community college, because I'm hoping to maybe work at one someday. But I study IO psychology, industrial organizational psychology. So,
and hopefully she'll be a guest speaker for us so that we can find the right timing.
yeah.
So, because that's a very specialized niche, right? Industrial and organizational psychology. Plus, you also have LMFT, right?
Yeah, well, I didn't get licensed, but I have the master's, yeah.
So lots of different, yeah, different experiences, right? So, and I think that's the best thing for you guys to hear different people's experiences, so you can, figure out what's the best route for you. And even when you think you know it, sometimes it'll change. All right, so practicing. So I have a couple of tables that kind of break down things a little bit more, but a master's degree that's not a developmental master's degree. There are so many different degree options out there now. I might be missing one, but because the license LPC, I have to cheat and figure out what that means. License? Professional clinical. I have it written down. Licensed professional clinical counselor. Yes. But that was like the newer one. But it is also, I guess, California didn't start acknowledging it till like 2010 or something like that. So that's why we don't have as many LPCCs as other states might. Why they didn't accept it, I don't know. But so master's degree, there's different options. LMFT and MFCC are very similar. So Masters in Family Child Counseling, LMFT licensed marriage family therapist. So those are very similar. An LCSW would be licensed clinical social worker, and then we just said what the LCC is. So basically these all are like kind of counseling adults, children, family, and couples, but mostly steering away from really severe mental disorders. You just don't have, I mean, that's the way I understand it. Like, you just don't have, as an LFT, have the qualifications to really be a therapist for someone with schizophrenia, perhaps. Do you think different?
Depends. It depends, I think, where you work, like what type of agency you work
I guess,
at.
yeah.
But a lot of places that would have clients with more severe stuff, like in a hospital setting or something, would want PhDs or PsyDs, but you could end up working with those populations for just a master's too.
Okay. So PhD is going to diagnose and treat mental disorders, same with a PsyD. So those are both doctorate degrees. And again, I have a table to break it down a little bit more. I was trying to think, I have all this stuff in my classes, but it's kind of very general information. So PhD is a doctorate in philosophy, and a PsyD is a doctorate in psychology. And so we're going to talk a little bit more about the differences. When I was going through school, PsyDs were just not very well thought of, I guess. But it's a total different world now. So PsyDs, I don't know if I would say they're more common, but it's just a different route, and it's a very feasible route now. So again, I just kind of broke it down. So the MFT, oh, those are the, well, you can kind of tell it is. Those are the people there on that. So focus mainly on relationships, families, couples. There's it's like the degree sounds for the most part, but I know like so my friend who's LFT because she had worked in an eating disorder clinic. Her specialty was anxiety and eating disorders. So that's kind of what she specialized in. Again, emphasize on systems theory. Of course, I don't have experience on this. I just this is what I read, right? But you can find anywhere from private practice, clinics, schools, community agencies. I think most people who, not most, but a lot of people think that they're probably going to do private practice, but it's, when you do private practice, you have to decide if you're going to take insurance. And if you're going to do insurance, how you're going to do that and, all that kind of stuff. I know some people don't deal with the insurance because of my friend. She didn't take insurance because she didn't want to deal with it. You also, you have to find a place to have that private practice. I have another friend who she does all of hers because she got her licensing during Zoom or during COVID. So she does most of her therapy over Zoom. So, and then, yeah. So the next one is, sake of time. The next one would be a licensed clinical social worker. So again, it's mental health, but also thinking about the social systems that are involved because and I think all of these probably work with there's overlap, right? But this is like the main focus of the degree. So when I think of a social worker, I think of a caseworker. I think of someone who's either supporting a family or a child who needs a caseworker, or I have a friend who works with senior citizens or older individuals. I think she did say she does call them senior citizens, but it's like it's not a title. And so she goes out to individuals that are older who are maybe they're living alone or somebody's reported elder abuse, those kinds of things. And so she's looking for ways to make sure they're mentally healthy, but also to what systems around them can support them. And then an LPCC, I think very similar to LMFT, but I guess more general mental health counseling. I think it's supposed to be a little different, like less focus on the family perhaps in their degree, but I don't really know. Again, it's kind of a newer area that I'm not as well aware of. And then a PsyD, so this is where a lot of times, so those are kind of the different master's degrees, and then this would be a doctoral degree. You think having a clinical practice and much less focus on therapy or on research, on research. So they're going to focus on the therapy while they're getting their degree. That's really the focus. Learning about different clinical settings, clinical options, but very little research. They typically will do a literature review type of dissertation, but not any research. And so private practice, hospitals, universities sometimes too. So when we were down at UCSD the last 2 years, there's been a guy who has a private practice, but also teaches at UCSD. And so you'll find them at universities too. And then a PhD would be very similar, except for there's a very big emphasis on research, right? You would say that. So there's going to be a balance of learning about therapeutic techniques and the different disorders and all that kind of stuff. But you're also going to do research. You're going to do a research dissertation. So it's preparing you for either academia, working at a research university like UCLA or UCI, or having private practice. So with Psi, you're not really introduced to the idea of research as much, so you probably wouldn't do research. But never say never. All right, so this is just another different breakdown showing kind of how long they take. So the master's typically somewhere from 2 to 3 years. Licensing, so that's in addition to the schooling, you do licensing, and the licensing, it looks like what I could gather is anywhere from 2,000 to 4,000 hours, kind of depending on the state and things like that. PsyD is typically about 4 to 6 years. There's pre-doctoral internship where you'd be shadowing somebody doing clinical work. And then your supervised hours are 1,500 to 1,000, again, varied by state. PhD, 5 to 7 years. You used to always say 4 years, but really, so how long are you taking?
5.
5, okay.
Yeah.
And that's in addition to your master's you already had.
Yeah.
Hey, it's just I did my master's and I did my PhD, and then I did a postdoc, and then I taught here. So I always tell people I never left school. I've never had a time where I wasn't in an academic setting. So it makes you a truly academic, right? And then you're going to have coursework for dissertation. your practica internships, which means again, that's like, it's like I think they call it practicum, but you're basically shadowing somebody and again, learning how to be a therapist. And then supervised hours. So when I say supervised hours, so my friend, I didn't understand this, but my friend who's, I don't know exactly which degree she has, but she has some sort of master's and she's a therapist. She, not the friend I was talking about with the LMFT, different one. Um, she shared with me, so she was almost through her licensing hours and then she had to take the exam. And she said that basically like her supervised hours meant that she met with clients on her own and then met with her supervisor after, and the supervisor, they would talk about compliance a little bit, and then she had to have her own separate therapist as well. But she said basically like once she took the exam and got licensed, her salary would double, her income would double because the supervisor got half of her income. So I was like, wow. But she also, the way she was doing it, she was getting a client list, right? You know, she had a client list. So when she was done, those were her clients. They were going to stay with her. They're not going to the supervisor. So like I know over here at Mental Health Services, it's that direction, I don't know which way, but at Mental Health Services, they have a lot of people that are doing their supervised hours. And so, but unless they stay there at Mental Health Services, they're gonna have to go off on their own and develop their client list. So different ways of doing it, probably different levels of pay. And then PhD is probably about the same. And then I didn't want to put it on there because I wanted to deter anybody. I just looked up the cost, like actually I asked ChatGPT last night. I was just asking for the cost of these different degrees. So master's degree, depending on the school you go to, whether it's a public school or a private school, anywhere from $20,000 to $80,000. So, and a lot of times, if you want to get through in 2 to 3 years, you're probably not working full time, maybe part time. Did you work when you went?
Yeah, part-time for the first year, but the second year you couldn't work because you're doing your practicum.
Yeah. So my sister-in-law is doing a counseling degree. She wants to be like a high school or a middle school counselor. And so hers is going to take, I think, 3 years. It's night classes, but she's finding like it's really hard to do her practicum hours because one, they're during the day. So it's like when, she's got her own clients. So she's an accountant going to become a counselor, but so I think she's realizing that her idea of I'm going to work full time while I do this is not quite as easy as she thought. And then a PsyD, it said anywhere from, I think it was 100,000 to 200,000, and a PhD about 50 to 150. So I don't know why a PhD is less, except for, I put this little asterisk, is it like for a PhD, you don't want to go pay. If you're going to do a PhD, you want to look for a school what's called fully funded, where they're going to pay you to go. It might not be not a lot. Are you fully funded?
Mm-hmm.
Yeah. So the idea is like when I did my PhD, I was in neuroscience, wasn't psychology, but I did my PhD at USC. And whenever I tell people, they're like, "Oh wow, this come out with a lot of student debt." It's like, no, they paid for me to go to school, and then they gave you a little stipend. Wasn't a lot, but you can live in poverty. I was lucky. I was married, so my husband worked full time, so it was just kind of that's what the life we got used to, right? But so you want to look for something that's fully funded, where they'll either give you a teaching assistantship, they'll give you a research assistantship. I was on a scholarship, and I really feel bad that I can never remember what the name of the organization was. Some organization wanted to give money to someone studying the brain, so that was the first year, and then the rest of the time I was on what's called a training grant. So it was a grant that a group of professors had gotten, was an interdepartmental training grant. So it was a group of people, most of them working on this long-term project, and they basically like it was a really cool experience because I was in a group with sociologists, with psychologists. I was doing my neuroscience PhD. We had, I'm trying to think what else we had, but it was all aging related research. And so we would sit through colloquium once a month, I think. And then we also met once a month to talk about our own research. And so it was really interesting to learn. It was in the school of gerontology. But so I didn't have a teaching assistantship or a research assistantship. During my master's, I did get paid to do research. So if you want to do a PhD, so you have to think too about the cost, right? So a lot of students think I want to do a master's because it takes less time. But if you can get into a PhD program, and it can be fully funded, then you come out without, it might take longer, but come out without the debt, yes.
Oh, is it for society, like, where is it?
I think you get paid, but I don't know how much. I mean,
I didn't get paid for my.
Oh, no?
Well, I got a stipend of like $900 total.
well, yeah, I think you're right. I think, well, you're in school to practice
Yeah.
some, you're not gonna get paid.
Yeah.
It's the licensing hours. You should get paid
Yes,
some.
once you've graduated, then it's like a normal job, you're getting paid like regular money. But when you are still a student, it's like internship volunteers, like,
Yeah, it's like student teachers in elementary school. My sister-in-law is like that too. Her practice, she basically said she has shadowing counselors at a middle school, and she doesn't get paid anything for that. So, so it's just something to keep in mind where like, the benefit of like, do I need to take out student loans or, those kinds of things. So anyway, I just wanted to bring these, I think that's the last slide. I just wanted to bring, oh, no, I have one more. These are other non-academic settings. But just, there's lots of other things you can do in psychology besides your master's or clinical practice. Like this is the color guide, just like what advertising you use to try to figure out what colors to use in their branding. So police dog, but advertising, all, sorts of different things. Thanks for coming.
Thank you.
But anyways, I just wanted to, since we didn't have a guest speaker, figured I have some of this stuff in my other classes, and I think it's good for y'all to hear kind of some of this stuff. And hopefully we'll have some different guest speakers over this year where you can hear personal experiences about what people do. Any questions?
I'm optimistic. There's just an explosion since COVID, mental health issues, and since we exploded into the internet, mental health is. I have a therapist in North Carolina.
Yeah.
And the demand in California is double digits growth every year upon year.
And there's a lot of people that don't.
Expanding on both sides, the research, AI driven research, how to integrate with anxiety of social discourse of how people interact or don't interact. So I'm pretty optimistic that we have a big swath of things that need to be filled that California can't even fill.
No, I definitely agree with that there. That there is a need for therapists. But I also want everyone to be aware that there's other things out there too, right? I don't know what I just did.
Yeah, no, make sure to keep an eye out for the next meeting. We're gonna have, if you have any like specific questions about like maybe working a job through going through school, next meeting, we're gonna have the master's doctorate in my bad.
Yeah, doctorate in sociology, master's in sports psychology.
The gentleman you were talking.
Yeah, he's actually he's not in my psychobiology, he's in my psychobiology class. So, so hopefully we'll see you all next time. If you have any other questions, I'm just gonna close this out.
Your office hours in person were 1 to 2 tomorrow?
Today.
Yeah. Well, thank you guys for coming. I appreciate it. Hopefully see you next time.